let's talk about the uveitis. Is it uveitis or uveitis?
Uveitis.
Uveitis. In juvenile idiopathic arthritis. Yeah, let's talk about it. Please define for us. Is it one of the 7 we were talking about?
No.
Or is it
it is a complication. It is a complication or a presentation. Another presentation. It's a way of presentation of juvenile idiopathic arthritis in some patients. The only arthritis which is it is not common is the systemic one. In systemic, uveitis is not common, but there is I don't want to go into the detailed classification because that will be very technical. There are some of the categories of the juvenile arthritis. The one which presents with fewer joints. The one which presents with fewer joints. Initially fewer than four joints. This one has the commonest presentation with the eye. But any juvenile arthritis, apart from the systemic one, can present with the eye complication, inflammation inside of the eye. Yes, and that inflammation inside of the eye can bring complications which can lead to loss of sight, loss of vision. So sometimes children present with loss of vision first. Then they go to the ophthalmologist when they are referred back to us. Now when you question them, then you find they were actually having some joint pains and backache and nobody knew. They only saw that the child cannot see properly. That's now when they started taking the child to hospital. But those achings here and there, they were not attending to.
Because now would an eye specialist be able to tell that this is more to do with rheumatic?
Yes, the eye specialist will be able to tell. From the uveitis, you'll be able to tell that this is rheumatic, and then send the patient to the rheumatologist.
Yeah, so that is good news because a parent seeing his child having an eye complication would automatically look for an eye specialist.
An eye specialist.
Yeah, and sometimes you find, like I remember in my case, my son had an eye problem and when I saw an eye specialist, he just told me this thing will clear after when he's 9 years or so, and he did clear. So it looks like seeing an eye specialist is the first thing.
Yes.
Great.
If it presents first with the eye, because it can present with the joint and the eye problem is silent. So normally if we find a child with juvenile arthritis, I always send them for an eye examination. It's recommended that you send them for an eye examination because it can be there but silent.
So let's talk about the inappropriate surgical interventions that have gone into curing or treating this disease.
So
they have gotten help.
There are different, there are two ways inappropriate surgery. Because sometimes if you have arthritis, which is supposed to be treated by a rheumatologist, but you start by seeing a surgeon. There's people who believe that arthritis, they call it bones. I don't know where that terminology came from. So when somebody has arthritis, they look for the doctor for bones.
Yes.
Just like the same way when somebody has a nerve problem, they look for a neurosurgeon. They call the neurosurgeon the doctor for nerves. You see. So those are misconceptions from the public. Those are misconceptions from the public, so that you end up seeking treatment from the wrong doctor. And that can lead to delayed institution of proper treatment. And of course, when proper treatment is delayed, then complications occur. So that you may end up with complications even though you are seeing a doctor. You are seeing a doctor, but you end up with complications. And then again, that is a situation whereby a referral was supposed to be done, but it it was not done. The other thing is inappropriate surgical intervention can also occur when surgery is done unnecessarily. That can also occur without knowing. Like in systemic juvenile arthritis can present, or Still's disease can present with things which look like acute surgical emergencies.
Yes.
So that without knowing, the doctors can do surgical interventions, like maybe in an abdomen, which is painful and swollen. So they may think there's surgical emergency here, and they open up the abdomen and find nothing to treat, not knowing that this is a presentation of systemic onset disease. Yeah, those ones have occurred. Yeah.
So would you advise one to keep seeking for second, third, fourth opinions before they engage their children into any procedures?
Not exactly. You see, now when to seek for second, third opinion is not something which is easy to define for the population.
Yes.
Yeah, because the thing is, one should be able to seek for medical attention. Let me say what is supposed to happen. One should be able to seek for medical attention, and on the other end, the medical provider should be able either to competently deal with the situation or refer, consult. That's the way it's supposed to happen. Now, second, third opinion it depends on the family, the patient, the family. When they feel dissatisfied with the first opinion, then they are free to look for another opinion.
Because I'm talking about that in reference to the inappropriate surgical procedures, and I'm thinking for one to avoid that, in as much as you're scheduled for the surgery, you need to seek for another opinion before you proceed. Otherwise, you'll still be stuck in the whole of inappropriate surgical procedure. It
doesn't happen every day. You see, these are rare conditions. Like, I'm sure that, like say now in a county hospital or even a level 5, the ones which used to be called provincial, if you present with what we call acute abdomen, an abdomen which requires surgical intervention, maybe because of very rapid onset of pain and swelling, things like that, the doctors there, they go by what is most common. You see? Yes. Thinking normally centered around, we call them common things occur more commonly. Yeah. So that can guide them, that can direct them to do the surgical intervention. Yeah. And then one of the cases I was seeing, the surgical intervention was done repeatedly until they went to a different facility, and the different facility is the one which now thought that this could be rheumatology.
Yes.
And the patient ended up with me. Yeah. So those are things I don't think I don't know how you can control them.
It's difficult.
Yeah.
So this sort of, correct me if I'm wrong, this mass is it exodus to India for further medical attention should not be blamed to the patients. In terms of, in Kenya, you find there's a lot of talking about Indian doctors go to India for this. Do you have something to say on that?
India doctors?
Yeah, you find a lot of Kenyans with chronic or complicated conditions find more faith, sort of, to say.
There are genuine better medical facilities and attention in India. There are also fake ones.
Yes.
Yes. A genuine one, you see, why the medical board decided to clamp on this.
Yes.
So that for you to go to India, you should be referred by a competent person who has decided that what you want to go and do in India is not achievable here. Or what you are going for is a junior medical intervention. Because I've seen Indians moving around in the company of Kenyans soliciting for patients from us to go and be operated in India.
Wow.
And you see, first of all, that is wrong. Then secondly, I've also seen some of them who have been advised to go to India for surgery.
Yes.
And they don't need surgery. I still remember a case of a very young lady, about 30-something years old. So they came as a group,
Yes.
very agitated, that they have been advised to go to India for hip replacement surgery.
Yes.
Then I asked, do you have a problem? They said, no, he had some, so the patient had some pain in the joints. Then there was done an x-ray. All they were holding was an x-ray. And then from that x-ray, they were advised to go for surgery in India. So I look at the x-ray, there's nothing wrong with the joint. But they are being told to go to India by a facility, which I'm not going to talk about. But those things are happening. So there are genuine cases where, like, if in the area where I belong, this of rheumatology, we can be able to decide what should take somebody to India or anywhere else outside Kenya. And interestingly, most of the things we can deal with them here. Very few in rheumatology will need us to send you out. But sometimes the patients think that because they have the relative, the patient may be okay with what he's getting, but the relatives may think that they are able to get treatment from a very expensive hospital in London. So they take their patient there. The cases who have done that, they have been sent back. They look at the treatment the patient is getting, and then honestly, they just tell the patient, you are on the right treatment. Just go back, continue with your doctor. That's the experience we have in rheumatology.